So in dental anatomy, you're learning the point angles. Now this is where three surfaces come together and create a point angle. So if we're looking at an anterior tooth, we'll refer to the top as incisal, and we'll refer to the front part as the labial for lips. And we're only looking at 4 different possible point angles. So here, we're distal, we're lingual, we're incisal for all of them, so it would be the disto-linguo-incisal point angle. We're always ending with incisal. It always goes distal or mesial, lingual or labial, and then ending with incisal. Now, what about for a posterior tooth? So the only thing that changes is the top is going to be referred to as the occlusal, and the front part is going to be referred to as the buccal. So now, again, we only have 4 point angles, so this one would be the disto-linguo-occlusal point angle. This would be the disto-bucco-occlusal point angle. Now you guys got it. Like and subscribe. This is Chaser Bordy with GamePlan for your academics.